Hello, I'm Dr. Safwan Ahmed Khan, consultant pediatric surgeon, using the AI voice for clarity. First, I want you to know that receiving a diagnosis of neuroblastoma for your child is overwhelming. Please know that you are not alone. This guide is here to help you understand this condition in simple, clear terms. My goal is to walk with you through this, one step at a time. What is neuroblastoma? Neuroblastoma is a type of cancer that starts in very young nerve cells. These cells are called neuroblasts. Before a baby is born, these cells are supposed to grow into mature nerves that make up part of our nervous system. Sometimes, these young cells don't mature as they should, and instead grow into a tumor. This tumor most often starts in the tummy, around the adrenal glands, which sit on top of the kidneys, or in the chest along the spine. How common is this condition? Neuroblastoma is the most common solid tumor cancer found in children outside of the brain. It is still considered a rare disease. It affects about 1 in every 7,000 children. It is most often diagnosed in children under the age of 5, and it is slightly more common in boys than in girls. What are the signs and symptoms? The signs can be different for every child, depending on where the tumor is and how big it is. Common signs include a lump or swelling in the child's belly, which might not cause pain, a lump in the neck, chest or elsewhere, swelling in the legs, upper chest or face, loss of appetite, weight loss or stomach pain, weakness, limping or refusing to walk, which can happen if the tumor is pressing on the spinal cord, bruising or bleeding around the eyes, fever, bone pain, and general tiredness. How is this condition diagnosed? Doctors use several tests to confirm a neuroblastoma diagnosis and see how far it may have spread. Ultrasound, or CT/MRI scan. These are painless pictures of the inside of the body. They help the doctor see the tumor, its size, and its exact location. Urine test. Neuroblastoma tumors release certain chemicals. A simple urine test can check for these, which helps with diagnosis. Blood tests. These check your child's overall health and how their organs are working. Biopsy. A small piece of the tumor is taken with a needle during a small procedure. This is the only way to be sure it is neuroblastoma. The sample is then looked at under a microscope. Bone marrow aspiration. A small amount of liquid is taken from the bone, usually from the hip. This checks if any cancer cells have traveled to the bone marrow, the soft inside part of bones where blood cells are made. How is neuroblastoma treated? Treatment is tailored to your child's specific situation. A team of doctors will decide on the best plan. Medical treatment. Chemotherapy. These are special medicines given through an IV, a tiny tube in a vein, that travel throughout the body to find and destroy cancer cells. They are very effective but can have side effects like tiredness and nausea, which your medical team will help manage. Radiation therapy. This uses powerful focused energy beams, like strong X-rays, to destroy cancer cells in one specific area. It is often used if surgery can't remove all of the tumor, or to relieve pain. Immunotherapy. This is a newer type of treatment that helps your child's own immune system learn to recognize and fight the cancer cells. Surgical treatment. The main goal of surgery is to remove as much of the tumor as safely as possible. The surgeon will make a cut, incision in the skin to reach the tumor and carefully remove it. They will be very careful to avoid harming nearby healthy organs and tissues. Sometimes, if the tumor is wrapped around important blood vessels, the surgeon may not be able to remove it all, and other treatments will be used first to shrink it. What are the risks and complications from the condition? If left untreated, the tumor can grow and press on vital organs. It can also spread to other parts of the body, like the bones or bone marrow, which can make a child very sick. From the treatment. Surgery risks. As with any surgery, there are general risks like infection, bleeding, or a reaction to anesthesia. Your surgeon will discuss all of these with you in detail. Medication side effects. Chemotherapy and other medicines can cause side effects. These can include a higher risk of infection, tiredness, nausea, and hair loss. These are usually temporary, and your medical team has many ways to help manage them. After the procedure. Care and recovery in the hospital. Right after surgery, your child will be taken to a recovery room. They will have an IV for fluids and medicine to keep them comfortable. They may also have other small tubes to help with healing. Our team will manage any pain very carefully. The length of the hospital stay depends on the extent of the surgery and how quickly your child recovers, but it is typically several days to a week. At home. Caring for your child at home is a key part of their healing. Wound care. Keep the surgery area clean and dry. Follow the nurse's instructions on how to care for the incision. Activity. Let your child rest. They can slowly return to normal, quiet play, but should avoid rough activities or sports until the doctor says it's okay. Diet. Offer small, frequent meals. It's normal for their appetite to be low at first. Offer their favorite healthy foods and plenty of fluids. Call the doctor if you notice a fever, redness, swelling or pus from the incision site, persistent vomiting, or if your child seems to be in a lot of pain that medicine isn't helping. What is the long-term outlook? The outlook for a child with neuroblastoma varies greatly and depends on the child's age, where the tumor started, and the specific features of the tumor. The good news is that many children, especially younger children, do very well with modern treatment and are cured. For other children, treatment can control the disease for a long time. Your child will have regular follow-up visits with the medical team to watch for any signs of the cancer returning and to manage any long-term effects of treatment. Our focus is always on giving your child the best possible quality of life, today and in the future. Please use this guide as a starting point for conversations with your child's medical team. They are your best resource for information specific to your child. You are your child's greatest advocate and source of strength.